Welcome to the Restoring Our City podcast, where we have unfiltered conversations on today's topics that are impacting our generation and our community. And there is no other topic that's impacting our community more this year than the coronavirus. And we are so excited to bring a very special guest, Dr. Linoj Samuel, who's actually the division head of microbiology at the Henry Ford Health System in Michigan. And this is a really great and important conversation about the impacts the coronavirus has had on our community, as well as an incredible breakdown of the vaccine itself, and then also how to approach maybe our family members, and even those who might be a little skeptical about some of these advances in medicine. And so it's a really important and critical conversation that maybe you got to share with some of your family members as well. So we really hope you enjoy this episode. And we want to thank you all for listening. Please hit that subscribe button. You can listen to this podcast on Apple Podcasts, Spotify. You can watch the video version of the episode on YouTube as well. And then follow us on social media to get the latest and greatest. We're on Facebook and Instagram and Twitter. And you can find all those social media handles on our website at restoringourcity.org. Thanks for listening. If you've been following along with our podcast, you've probably heard us say the tagline of we're having unfiltered conversations on today's topics that are impacting our community. And I can't think of another topic that has impacted our community more this year, and not just our community, but the world, right? Than COVID. And this is something that we've been talking about as a team for a long time to really get some expertise on to discuss this worldwide pandemic. And that's the topic of the conversation on this episode. And joined with me on this episode is Steve Chaco, my fellow collaborator and brother from the Michigan area. How's it going, Steve?
Good. Doing good. Thanks for having me back on here.
Yeah, absolutely. We're super excited. So we have Dr. Linoj Samuel, who's the division head of microbiology at the Henry Ford Health System in Michigan. And to my understanding, that was one of the first hospital systems to run tests for COVID, back in March, right? It seems like you guys have been, involved in this. So Linoj, thank you so much for being on. How are you doing today?
Good. Thank you for having me on. I do appreciate you guys taking the time to talk about what is a really important topic to our community today.
Yeah, absolutely. And so tell us a little bit about yourself and just kind of introduce yourself to our listeners and the line of work that you do.
Yeah. So I've been in the field of microbiology for, 20 odd years now. I started out back in, I grew up in the Middle East in Kuwait, but I did my undergrad back in Kerala in microbiology. And then I came over to the States and did my graduate school work in Arizona, at the University of Arizona. And then I I really enjoyed my time there. It was a beautiful place, but I had to move up to the snowy Northeast. I was in upstate New York for a couple of years doing a fellowship there. And eventually, after I was done with my training, I got a job in Detroit, Michigan. And, it was all, again, I think there's a lot of story there in how God worked in amazing, mysterious ways. Because it was, the way I say it sounds really straightforward, but there was a lot of challenges and hurdles along the way. And it was amazing how God brought us to the point where I'm here in Michigan, where my wife grew up, and we have a ton of family on both of our sides. So God has really been amazing, blessed us along the way.
That's awesome. And I've been privileged to know you a little bit just from visiting Steve in the church there. It's awesome to see. And I had no idea all the great, amazing work that you were doing in just the healthcare field. And
that's actually really funny. I want to kind of touch up on that too. Like, I don't think anyone realizes, even in our own community, how much Linoj is involved in the healthcare, like in terms of like COVID and like the testing and how much impact him and his team have had, or even that hospital in the state of Michigan. And even I'm just touching up on it. I'm just throwing buzzwords out there for Linoj, but like this guy is very accomplished. I'm glad to have Linoj on, but even him on a personal level, like at our church, we have a group called Young Adults Bible Study, termed it YABS, but Linoj heads that up and he leads the group, definitely with vision, but also with, week after week with Bible studies and helping coordinate that.
We were privileged to have a really engaged, accomplished group of people, and Steve's a big part of that. I think he probably understates quite a lot of what he does in many ways.
We can get into that later, but how about some accomplishments for Linoj? Like, I mean, even just recently with COVID and stuff, like, I know it's not the easiest thing to toot your own horn. I don't necessarily mean to say that, but with accomplishments within that industry and just in the past like years and stuff, are there any things that you want to kind of touch on or share? Yeah.
I mean, I definitely not, I agree with you. At some point, it's important, you don't want to toot your horn, but some things I do think it's important to also talk about and address in the community, just from an awareness standpoint. But, going back, even in terms of just my walk along this career path, it's not like doors just opened because of my gifts or my skill sets. At every step of the way, you feel like many do in science, especially. A lot of people feel what's called imposter syndrome, which I'm sure most of you know, where you feel like you don't fit in because everybody else is so much more accomplished than you are, and it's a pretty common issue among scientists, but more so when you're trained abroad and you're coming to the U.S. and all these people are like, amazing skill sets and extracurricular activities, and you don't have any of that. And I think God has done amazing things along the way to kind of open doors at the right time. I mean, I spent 4 years in undergrad in India, and then I came here for spent 5 years in grad school. But after like 9 years of education, I didn't know what I was going to do next. You would think it would be clear cut. You knew that, this made, and people probably in our community, especially, be like, what have you been doing with all this time? I had, after all, and the very last year of graduate school, my mentor, who was supposed to be the one that guides me through the PhD process, actually took a year off for medical reasons. And I mean, that is just horrendous when you think about your relationship with your mentor is extremely close, and they're the ones that guide you through that path. And so it made it really challenging to navigate that. And you're wondering, like, why is this happening to me? And why God, if you allowed this to happen, and you have a certain time frame for getting things done. After all that, I had one interview lined up and nothing else. And because my mentor was out for medical leave, my thesis committee felt pity on me and let me leave early. They did my thesis defense early. They let me leave early. None of this would have happened otherwise.
Wow.
He would have made me jump through all these hoops. And he was a great guy, don't get me wrong. But all of that happened. And at that moment in time, you're not seeing the bigger picture, right? You're just wallowing in self-pity. But It was amazing how God opened those doors and made those things happen. After my 2-year time, I didn't have the opportunities that I thought I should have. And so my mentor said, just hang on for a bit and see what happens. And lo and behold, we prayed really hard, and out of the blue, God opened this amazing job opening in Detroit, Michigan, where my wife was born and raised. And here we are, I mean, it was just like, I'm pretty sure the church here was like intensely fasting and praying that had something to do with it. But there's I've been involved at the national level of the organization, and just to show how God works. And at this point in time, our national level organization has a committee that oversees all these fellowships. And most of these fellowships, not for their own fault, but they couldn't interview with me at the time because now there's like 20 fellowships. No, they couldn't interview me at the time because I was a foreign grad. I didn't have an H1. I didn't have any of those things. And, through some, and I now don't understand how it is, but I'm now chair of the committee that oversees the fellowships that I could barely get an interview at, and that's the grace that God has in doing amazing things in your life and just making things happen in miraculous, wonderful ways. And even now, and 6 years into that position, I'm still don't understand how I'm there. It's only by His grace that we get through that and we're able to do whatever we can do.
I was going to say it could only be God that would move you from sunny Phoenix and Arizona, right? To Michigan.
It was Tucson, which to me is even better than Phoenix. But,
it's beautiful out there, isn't it?
Yeah, I loved it. But it's not for everybody. My kids are born and raised here. We took them out to Tucson last year, and they couldn't understand how I could live in such an
You chose to live here, Dad?
Yes, there's no grass, but for me it was just amazing, beautiful outdoors, a lot of wide open spaces, but
that's awesome to hear your story too, because it shows that God ordains your steps to be where you are. And then obviously you're making an impact in the community. I guess, could I ask you, Linoj, just obviously with this pandemic going on, how's your family doing? How are you doing? Is everybody staying safe and healthy?
Yeah, no, I think by God's grace, I think the biggest challenge has been that for us, we've been going nonstop since March when this first came out. The first week that this happened, and most of us thought that this was something that was just going to stay in China, just like all these other new viruses, and I thought the same. And then next thing you know, it's here, and you're scrambling to make things happen. And we, at that point of time, I still remember very clearly, we worked round the clock for about 2 weeks because we were trying to get people COVID tested, and it was taking several weeks. The only option in the entire state of Michigan was the health department, and they were overwhelmed. And so we literally had a team of people, including ourselves, working around the clock, and we had to build. You couldn't buy the COVID test from anybody. You guys essentially got the raw materials and built it from scratch, and we did that. And we were, like as Steve said, we were the first lab, but not by much, by a couple of days, the first lab in Michigan to go live. And it was incredible. I remember the moment us running that first series of tests and realizing that 40% of our patients were positive for COVID.
Wow.
And up until that point, we didn't know who had it or how many had it. And it's just like a scary thing looking at that screen. And those first couple of months were very intense. I mean, we had at least 1,000 patients in our hospital system. So we're a 5-hospital system. And, I think by April, we had cleared out most of the floors, and every floor had COVID patients. And most of them, at that time, we didn't really know what to do with them, how to treat them properly. We're obviously a lot better now at that than we were then. But it was just a very difficult time, and we would have daily strategy calls. And so part of my job is running the lab. So I run the microbiology lab for the Henry Ford Health System, which serves all 5 hospitals. And so any kind of infectious disease testing comes to my lab. And we run 24/7 round the clock, and people were just burning out. I mean, you can only do so many hours before you start to wear out. And it was a challenge, and I'm really proud of our staff, in terms of how they stepped up. People were doing long shifts, extra hours, not because they needed the money, because that was what they needed to do. And that was all happening behind the scenes. You see pictures of nurses and doctors in the front lines, and they're doing their job as well. But our lab, I mean, at one point in time, we were running 2,000 plus COVID tests every day. That was 2,000 samples every day that had to be handled manually. Each one needs to be manually handled before it can be tested. And so, and in the early days, we didn't know what was going on and how dangerous this really was or what the risk was. I mean, our staff never really hesitated to handle those hundreds of samples, and because their risk is just as real as the risk of someone who's handling or who's dealing with an actual COVID patient.
Sure.
You might actually have a risk from it. Now we know what we're doing, so we're a little better off. But at that point in time, there was a lot of fear, and no one stayed home and called in sick because they were afraid to do that. They stepped up, So we're part of the team that we had there that did all that, because we worked to build that kind of team ethic and workload, throughout the last couple of years. So it was really, I think, a challenging time. And then you're dealing with, the fear at home, right? Your kids are not stuck at home, and you're trying to navigate your social issues, community issues, your family's all over the place. And I'm on these calls, and there's nurses on these calls who are literally in tears because people died right in front of them who were perfectly healthy one moment and just crashed the next. And then you come home and you listen to people talking about, oh, this is a hoax, this isn't real. And it's like a slap in the face,
Yeah,
and
absolutely.
If one thing I want to stress to people on this call is we say a lot of things on social media because of what we might belief system or what our opinions are, or we think we've investigated and whatnot. This is an incredibly complex issue. I mean, I've spent a good 25 years doing nothing but infectious disease testing, and I can't even begin to pretend that I understand all there is to understand there is about COVID, right? In the last year, I've done nothing but the COVID, and that's all I've done. And then, and then you come home and there's people in your own family telling you what they know about COVID. And I think that one time I pushed back against a family member and they said, don't take it personal. And I said, no, it is personal. When you go on social media or you're in the community saying things that this is a hoax, you are really condemning your family members or church members or community members who are in the healthcare community who are working day and night to do this stuff to save people's lives, or to come home and have people tell them that they're involved in hoax. There's no way this can be a hoax, because if that's a hoax, we'd have to be part of it. Okay, my lab runs 2,000 samples a day. We're reporting COVID results. If there's a hoax, then that means I'm a part of that hoax, right? And that's what you're seeing when you're making those allegations and those things that you're saying. People really don't understand. It's so easy to do commentary on social media and to make comments offhand without thinking about what you're saying. And I think that's the nature of the world today, that, I hate to say it, I hate to sound like that person, but watching a couple hours YouTube videos does not make you an expert in anything.
Right.
Please say that louder,
sure,
please.
I'm sure that makes for interesting, like, Thanksgiving or holiday or Christmas conversation around the dinner table.
This is an incredibly complex issue, and we do understand a lot more about it now than we did before. And I think we're a lot better at handling patients than we were before. And it's unique in the ways that I think it's generated a lot of fear in the community. So you have all these extremes, people who are just paralyzed by the fear of COVID. And then on the other hand, people who are in complete denial about COVID, right?
Right. And I think that's a good place too, to like consider even how it impacts our community, right? When you're touching up on fear, and I don't mean to cut you off, but I want to go along that train of thought. Like, how have you seen COVID and this pandemic impact like our South Asian community? Like, you've touched up on your family, which is South Asian, of course, but in terms of the community at large, or even on a personal level, I guess.
Yeah. So it's challenging in the sense that, our community thrives on in-person, the church is the center of all social activity, and the church is all about in-person meeting. And if you can't do that, then I think there's no way to describe the psychological impact that has on people. We're not meant to live in isolation. And I'm very sympathetic to folks that have really strong feelings about the quarantine restrictions, about those kind of limitations that were put on meetings, especially early on when we didn't know what we were doing. And while I'm sympathetic, at the same time, I also see firsthand what happens to people that didn't take those kind of precautions, right? And so I think there's really a fine balance to be had. On one hand, I think there is room for social interactions within a certain framework. I think we see that within our own church, where we're having services every Sunday, but that's possible because we have a fairly large sanctuary. We have a smaller number of people coming in person versus less people on and the rest of them on Zoom. And so I think there is room for us to have that social interaction and not completely cut people off, and to have those kind of support systems in place. But it has to be, you don't want to go to too far of an extreme where you cut everybody else off and isolate themselves, because it's been 9 months. We need to support people. We encourage people. Sometimes we do need that in-person interaction. But we also need to be careful when we do that, do it within these a framework of having distancing, wearing masks, and understanding that when you choose to wear a mask, it's not a personal choice. You're choosing to do it to protect the people around you because you care about them. Okay, it's not about your belief system. It's about taking care of the people around you, which if you do love them as part of your community, you would. So I think I do think the community has been affected, in especially South Asian communities and communities that thrive on that personal interaction. It has been a significant negative impact, and I worry about people who are isolated and what they're going through, and we don't talk about challenges and addictions and depression and all those things. We don't talk about that in person, let alone when we're isolated. And so I do think that as a community, we do need to work towards that, and that's why I'm supportive of us continuing to meet in person, as long as we do things in the right way and form. There's just far too many examples of churches that have not taken those precautions, and people have suffered for it.
Right. I think that's a good point too, in terms of isolation and just really the emotional or social well-being of our community at large. Right. Having had COVID, just quick story, I shared it with some of the guys. Like, as soon as I found out I had a quarantine, doing some email, just working from home, watching some YouTube clips, scrolling Instagram, on Facebook, catching up on the things. And I was perfectly fine. Like I was isolated. I was able to chill and hang out by myself. Afterwards, I was like to a place where like I just couldn't handle it anymore. I was stuck in this room and I realized I couldn't open the door handle and look outside. I can hear things. I just can't be a part of it. And I texted Rebecca, my wife, and I was like, I don't think I can handle this. This is going to be like 10 or 14 more days. And this is just crazy. And she's like, Sibby, it's been 1 hour. And I was like, what? I've done everything on my list to catch up that I usually would do. And I was scrolling through some articles and I read something where it stated that I forget the exact percentage, but a very high percentage from what I perceived gets diagnosed with a mental issue or disorder. Those that were COVID positive and had to isolate, like within a short span of time after isolation. And just that alone, like within our community, I mean, from your perspective too, like the impact on the community for emotional, social well-being.
Yeah, I wouldn't say that's my area of expertise. And I don't think we've done a good job of addressing that just because, we've had such a single-minded focus on the physical aspects of dealing with COVID directly. And I know that now we're starting to have those conversations in the meetings that I'm in, where primary care doctors are talking about children and the impact of the isolation on them and on the health. You can't go outdoors now as much now that it's cold. How does that affect the long-term health of children, of adults? And that's just the physical well-being, and there's the mental well-being. And I think the challenge for us, at least in healthcare, has been we have really struggled, since March, just trying to keep our heads above water. And we've struggled with supplies. In some instances, we were just trying to figure out how do we get to like next week without running out of the things that we need, And even in the summer when COVID was down, none of that eased up for us in healthcare, especially into the testing in the laboratory side, because we were just constantly testing. We were constantly having to innovate and come up with new methods just to keep our heads above water, to keep testing going. At one point, we couldn't get those cotton tip swabs, the stuff that you throw away after you stick them in your ears. We couldn't get those, and we were 3D printing them out of a place in Ann Arbor, in Michigan, because we couldn't get our hands on them. That's just how bad the situation was. So my point in saying that was that we've been it's been such a difficult situation just dealing with the immediate issue that we haven't begun, I think, at least from my perspective, to properly address the other issues that come up. But they're starting to now have those conversations, They are starting to talk about what is the long-term impact of this on people, on children, and whatnot. And it's definitely something that needs to be considered. But I think the sad part of this is that if we had gotten together, if we had worked together and really come together as a country and a community, then we might not be in this place where we are now, or we're dealing with a second or third surge or whatever it is, whichever part of the country you're in. We might have been in a much better place if we had addressed this properly the first time around. And I think some of the challenges has been, people just not buying into the messaging and buying into that. And so really, I think we have to shoulder a lot of the blame ourselves as people, as community, for where we're at. This isn't just on healthcare. This is on each and every one of us,
The growth of misinformation is an issue, right? And we talk about it kind of high level, but we don't get into like a personal discussion about it to really talk about like what we all think and what we all, I guess, consider about this vaccine or even the pandemic as a whole. And that those things do isolate us, right? Those things do prevent us from growing, I guess, even as a community during this time. I mean, I guess the biggest question is the vaccine. It's coming out.
Yeah.
What have your involvements been in terms of the vaccine, and like what is the benefits of it?
So I haven't been directly involved in the vaccine, from our perspective, but I'm on the hospital vaccination committee, and so we do talk about it, and we're involved in decision-making part of that, and our staff were frontline to be vaccinated, and so that's happening even as we speak. I think one of the challenges with disinformation is it's easy to believe what's in front of you, right? What you see with your own eyes. And it's different when as a scientist, you look at data and you take a more of a different perspective to it. So when you think about COVID, the vast majority of people that we know who have had COVID have either had it asymptomatic or have had it mild, and this is true. I mean, 40% of people who have COVID will have no symptoms. There's no disease like this in that sense. And of the rest of them, 80% will have very mild symptoms or disease, or maybe mild to moderate, a bad cold, fever, chills for a couple of days, and you'll get like the body aches and maybe loss of taste and sense of smell. When that's what's out there, people start to think, well, what's the big deal, right? But the big deal is just out of that, now we're talking about 80-90% of people have moderate to mild illness, but it's the remaining 5% that end up in hospital, and that is a huge number. 5% doesn't seem like much, but it is thousands and thousands of people that end up in the hospital, and some of those people die. Some of those people have lifelong disease, and so a lot of people go by what their first impressions are, what their immediate impression is of, well, here's my experience with COVID. I don't know what the big deal is. At the same time, many of us know people who have had severe illness or even passed away. So the same applies to the vaccine. You see the vaccine roll out, you hear a lot of videos talking about how it's been rushed. And yes, the timeline for the vaccine was a lot faster than you normally would have. I think it's important to understand that the vaccine technology is not brand new. It's been around for 17 years. It just hadn't been used in an actual product yet. Okay, so that's number one. Number two, we were actually one of the clinical trial sites for the vaccine, and we recruited thousands of people. When I say we, I mean our institution, not me personally. And I think that overall, if you look at the data presented, that it has a very good safety record in tens of thousands of clinical trials patients. And yes, when they've rolled it out now, so far to date, I think about close to 300,000 people in the US have already got the vaccine, right? But we're talking about 4 or 5 people in the news who've had anaphylactic reactions. Now, sure. That's 5 people out of 300,000, 5, 6, 7 people, whatever the number is. Those are real people, don't get me wrong, but they had temporary symptoms. They were given the treatment, they got better. And nobody had permanent issues in that group. They were all relatively fine after a day or two, and some of them fairly quickly. And so in that sense, we focus on those things to our detriment, in that absolutely there's going to be more of those cases where people have a reaction. Coronaviruses have been around for centuries, and we've never been able to come up with a vaccine to them because none of them have been good enough. And the fact of the matter is, you need this novel technology to actually come up with a vaccine that works. And we know that it's got like 95% efficacy against this virus, which is incredible. I mean, something short of incredible. So the downside of that, or the upside of how we look at it, is that it kind of generates a very strong response, and that response in some people can get a little overexcited, and that's when you get people having these reactions that you see in the media. My take on that is, I'm not going to tell anybody there's no risk, and I'm not going to tell everybody the vaccine is going to be perfect. There's going to be people that have reactions, and there's going to be challenges with the vaccine, but whether you take the vaccine or not, you're choosing to take a risk. And you have to balance out what that risk is going to be. If you take the vaccine, there's some small amount of risk that you'll get a reaction to the vaccine. Most likely, it'll go away after a while. But if you don't take the vaccine, you're running the risk of getting COVID. And who knows what kind of COVID you will have. You might have the asymptomatic COVID, or you might have a severe case of COVID, which can happen in any age group, and you might have lifelong issues because of that. So, the idea that sitting back and waiting is a safe option is not necessarily true. Either way, you're making a choice and you're taking a risk. And it's a matter of which risk are you choosing to take. And the more people take the vaccine, the better the long-term outcome is going to be. At this point, it seems like half the country is not going to take the vaccine, which means that we're going to be dealing with this for a long, long time to come.
That's great, Linoj, and I appreciate you even sharing your insight into the vaccine process and even the concerns that maybe the public has. And so would you say that's still similar to other vaccines for any other disease where there are side effects and there are small portions of the population that might experience different types of symptoms? Is that kind of the same kind of vein, but people are a little bit more, impressionable about, or even just skeptical because of the state of the country right now?
Yeah, and I don't want to kind of blow off people's concerns either. I think people need to ask questions and be educated and understand what they're getting into. There have always been, especially in the last couple of years, there's been issues with the vaccine debate and folks that kind of linked vaccines to autism and other side effects. There'll always be a small number of individuals that react negatively to vaccines, whether it's some component of the vaccine itself or whether you have allergies to the parts of the vaccine. That's always been the case. It's usually a very, very tiny number. And the way you look at it is from a cost benefit perspective. If they didn't take the vaccine, then people get the disease. We think of measles and chickenpox and we think, oh, what's the big deal? But the fact of the matter is there's actually a small subset of people that get measles and chickenpox and have really lifelong issues. You can get chickenpox pneumonia. You can get measles, meningitis, and encephalitis where it infects your brain. And those things happen in numbers that people would be surprised to know. So when you think about how many people might be impacted with the vaccine, and I want to make it clear, there's no evidence that autism is linked to vaccines. But people do on rare occasions have allergic reactions to vaccines, most of which are transient or temporary. That cost is out, that the risk is outweighed by the risk of all these other issues that come up with getting chickenpox or measles. And so, the things that we've done with vaccines are nothing short of extraordinary. I mean, we've eliminated smallpox. Polio is almost out the door. I had a buddy in school who grew up with polio, and he had permanent disability because of polio. And people have lost sight of that, of what's been done over the years with vaccines. And so, yes, so some of that has been kind of exacerbated because this is COVID. And this is something that's been kind of accelerated pathway kind of approval. And, I mean, people are nervous, and it's normal to be nervous. And, I think they need to educate themselves, understand, look for reliable sources of information, talk to people and understand what you're getting into before you make your choice.
I just want to touch up really quick, too, because you brought up some of the other vaccines, but this COVID vaccination, from what I understand, it is different in terms of how it acts from a science perspective, right? Can you touch up just briefly on how that is different?
So it is. So that's what's new about the technology, in that the first two vaccines that were approved, the Pfizer and the Moderna vaccine, are what's called mRNA vaccines. So normally when you get a vaccine, it's usually either a weak form of the vaccine of the virus itself. You weaken it and you inject it in the body. It can't cause disease, but it's around enough to get an immune reaction to show up, right? And generate an immunity reaction. But or you take a piece of the virus, which is like a protein component, like a chunk of the virus, and you inject it into the person, and the body recognizes this as a foreign component, enemy, and then develops an immune response against it. What's different this time is that they've actually taken a portion of the virus's genetic material, not the whole virus, but a portion of it, and they're injecting it into your body. And what your body is doing is taking that little portion of genetic material and converting it to the protein, or like the shell of the virus. You're actually making that yourself from this gene, this genetic material, RNA, that they give you. Now that RNA, once injected in your body, it does its job and it's destroyed. It doesn't hang around. It doesn't incorporate itself into your DNA. It doesn't turn you into zombies. It's not capable of doing any of that. So it's RNA by its nature is extremely delicate. It just gets destroyed really easily. And that's why they have to have these like -70 freezers floating around. Okay, this thing is extremely delicate. That's why they have this whole cold chain thing that they need to transport the vaccine. So this is new in the sense that you're injecting this into your body. Your body's making something off of it, generating that reaction to it, and then that thing is destroyed. Then it's gone, right? So it's a novel approach to vaccination that might revolutionize how we approach vaccination for a lot of other diseases as well. So it might change a lot of things, not just for COVID. Now, It's new technology, yes. And I'm not going to say we absolutely know everything 100% there's to know about it, but they've been working on it for 17 years. And the data we have, we can just go by the data we have to this point, is that it's overwhelmingly has a fairly good safety profile. You just got to watch out. Some people do have a strong reaction to it within the first half hour, A lot of people will have fever, body aches within the first day or two after you get the vaccination. Some of my coworkers have seen that, but then you're back to normal within the next day or two.
That's great, and this is such a great lesson, especially when something so cutting edge and so new. And Linoj, I think you touched on a lot of this as far as the concerns from the community, and maybe even from the South Asian community. I've seen some of those toxic social media posts and folks who are questioning the science behind it, and maybe we can take this conversation in a different direction, where some folks have ethical concerns about vaccines. I'm not sure if you've seen some of these comments about, oh, well, it's from aborted fetuses, and what does God think about that? Could you touch on, just even from a Christian perspective, how should we approach this subject as a whole, even from a vaccination standpoint?
Right. I mean, the simplest answer to that is that the vaccine does not contain aborted fetal material.
Great.
So I think that should be made clear up front. We could probably have a complete other podcast about the role of aborted fetal material if and when it's been used. I think it's kind of been like this boogeyman that they use for everything that comes out of the scientific community that has like aborted fetal material, when that's often not true a lot of the time. And so it doesn't have that. And I think the same is true. We have a lot of people. It's ironic that, as a community, we place a lot of emphasis on education and qualifications and this, that, sometimes to a fault, right? We're a little overbearing on that sometimes. But when it comes to it, we look down on the people with the qualifications and the training and the education that we built to begin with. And this is just one of the many ironies of our community that we have. And, you hear different things about it. And I think that, God has given us the wisdom and the understanding, and insight, and put a lot of smart people in the right places to do amazing things. And I think this is some of them. But also, I do think that, you hear comments like, oh, well, on one hand, you have people just completely in fear at home, completely avoiding everybody. On the other hand, you have people saying, well, I live in faith, I walk in faith, so I don't need to fear anything. But I don't think that God ever intended for us to behave and act in that way. We are meant to be law-abiding citizens, following the rule of law, following recommendations, following wisdom, right? I mean, read Leviticus. God didn't say do whatever the heck you want because no disease will fall upon you. I mean, there's all kinds of quarantine restrictions. We're doing a Bible study in Leviticus and Hebrews right now, and it's all about quarantine restrictions if you read it. I mean, that wasn't blasphemy then. Why is it so crazy now? He told them what to do, how to avoid disease, what restrictions to take. This is no different. People talk about this as persecution. I honestly don't think that they understand the meaning of the word persecute. And I think that wearing a piece of cloth over your face is not persecution. It is doing something out of respect and love for your community members. And so that's, I think, the challenge within our community is we have this sort of love-hate relationship with education. When it benefits us and when we want it. And I think that we need to understand, yes, you don't want to live in fear. Absolutely not. But, and that was important to me in my walk because, people are working from home, but as, me and my colleagues, we didn't get social distance at work. Even from the beginning, we had to go to work every day. We had to work in close contact and we didn't have a choice. You can't live in fear. You do your job, you do the best you can, and you trust in God to take care of the rest. But it's true. But you don't behave willfully and arrogantly against good, proper, advice from people that only you want what's best for you.
It's really concerning sometimes when even people from our church community may have, throw out that misinformation or share some of those social media posts and be the authority on what God is thinking, right?
Right.
And we have folks in places of authority and positions within the healthcare system who are giving us that instruction. So no, I appreciate it. What are some things that you would want our community to know about just dealing with something like this, like a worldwide pandemic? Is there something that you would like to emphasize for like our listeners and our community to understand?
Mm-hmm. I mean, I think to some extent we covered some of it. I think the challenge has been that, especially with what is a novel disease and something we've been learning things all along, there are situations where as we learn more, we change the things that we say. And people have used that as a stick to say, well, back then you said this wasn't true, and now this is true. Before the pandemic, Fauci himself was on record as saying that, oh, masks don't help. Well, then we learned that that's not true. They do help. I think this is partly one of the issues, and this is true for any scientific subject. As you learn, you change your guidelines and your recommendations. And to be honest, at the time when he said that, I disagreed with him. I had all of our staff wearing masks from the beginning. I didn't stop because he said that. And this is true. Again, within the scientific community, there's always a good discourse and a conversation going on about what's right, what's wrong, what does the data tell us, how do we know what's true and what's not. And you can't do that unless you're having that conversation, like talking to people that disagree with you. And this is true not just for COVID, it's true for everything. I think it's gotten to the point where even in the church, we can't have these conversations because people have very strong feelings about it. And not just that, it's become politicized, and it shouldn't be. This isn't political. This has become politicized, and we can't talk about it. And we absolutely need to be having those conversations, honest conversations with people who disagree with you or have those. And I think it's important also for us on the healthcare side to talk to people who have misgivings and try to educate them. And I think that's why it's great that you're doing this, even if it changes somebody's perspective or mindset about it. I think this is the kind of stuff we need at the community level, to engage people on the subject.
Thank you so much, Linoj. I feel like that's kind of the goal for even us having these conversations, because we feel that those conversations can spark healthy dialogue, and then ultimately looking at it from a Christian perspective too, right? Like that we're not just ignoring science, but we are being disciplined and using wisdom when we make choices, and understanding different perspectives and trying to gain that knowledge. Right. Thank you so much for being on. This is such an important topic, and I know this hits home for a lot of folks. I know people in our family, and Steve, you just even mentioned going through COVID. I know it's December now, and Linoj, we just appreciate you, and we want to say thank you to you for all the work that you're doing. You probably don't hear it enough. And there's so many people in our community that are healthcare workers and have been grinding and working so many long hours. And it's really disheartening sometimes to see people just completely disregard this, but we appreciate you being on and helping educate myself. I feel like this is a win already. I've learned so much, and this is such a relevant topic. So thank you so much.
Thank you so much.
Yeah, no, I'm glad. I think, like I said, thank you for considering this topic. And if people take nothing else away from this, I think that remember that when we make comments and statements on social media, or even in public, or even other people, consider their own experiences, where they're coming from, and the fact that you have healthcare workers in your family, in your community, and that there's nothing wrong with asking questions. I think approach it with an open mind and be diplomatic about it, really, and with a willingness to understand and learn. Right? I don't think that at any point, the more I learn about the subject, the more I realize the less you know. There are no certainties here, right? And things are changing every day. So we continue to gain knowledge, and as we do, want to share it. But you have to be willing to share a conversation. And we're all stuck in this feedback loop where we listen to people say the things we want to hear, and that just feeds into this mentality. We need to get out of that, So, and on our end, we need to do the same thing too. Like, we need to listen to what people on the other side are saying, so that we can actually put together meaningful conversations and discussions for them.
Yeah, absolutely. I love that faith and science don't have to be like so far apart on the spectrum, right? Like we can have it together, and like the science that God has given, or like the wisdom he's given, like you and people in your line of work, or even in this community that are healthcare workers, can use that as part of their faith, right? To reach others and to develop that, help people within our community even. But yeah, that's awesome. Thank you so much, Linoj.
Yeah. Linoj, we appreciate you being on. We can't wait to share this with everyone. And for all of our listeners out there, we're hoping everyone stays safe and healthy. And Linoj, we wish the same to you and your family. We just thank you for being on. And we hope that we can make a trip out to Detroit and visit Steve and you guys at the church again soon.
Yeah.
So
get your vaccine and we'll be ready.
Yes, get the vaccine, then jump over there. So awesome. Thank you so much, Linoj. We appreciate it.
Thank you.
Thanks for listening to this episode. We really hope you enjoyed that critical conversation on the impacts of the coronavirus. And so if you've enjoyed this podcast, we really hope you hit that subscribe button. Follow us on Apple Podcasts. We're on Spotify, as well as the video versions are up on YouTube. So follow us on there. And you can engage in the conversation as well via social media. We're on Facebook and we're on Instagram and Twitter. And you can find all that information on our website at restoringourcity.org. And if you really like the podcast, we'd love to hear from you. Share a review on Apple Podcasts. We'd love to hear your feedback and what we could talk about in the next upcoming season. So thanks again for listening, and we look forward to connecting with you on the next episode.